and then I will introduce our workshop hosts and discuss the run of show. So just a minute or so. Okay, so it looks like we're having a slowdown of folks coming into the room. So I think we're gonna go ahead and start. I just want to let everybody know that the first 20 minutes or so of this event is going to be recorded and live streamed. And then I will let folks know in the chat when we've stopped recording and when we stop streaming so that we can move into a Q&A portion of this session that's, you know, closed so that we can be as open as we want to be with the types of questions that come up. So with that said, let me go ahead and introduce our amazing workshop hosts. We have Dr. Farzana Salim. Could you, yeah, awesome. And then we also have Dr. Jessica Jackson. And Dr. Salim is an assistant professor in the Graduate School of Education at Stanford University. And her research examines the influence of racial stressors and culturally my animals are going crazy, culturally relevant practices on psychological health, academic success, and the well-being of Black adolescents and other youth of color. And Dr. Jackson is a licensed psychologist with a private practice in Houston, Texas. She also works in digital mental health at the intersection of mental health interventions and diversity, equity, inclusion, and belonging. And both Dr. Salim and Dr. Jackson are co-founders of Communicating Grace Fully. And I will go ahead and drop that link in the chat for those that are interested. And without further ado, please take it away.
Thank you. Thank you all. We are excited to be here. Dr. Salim and I, as Dr. Squivel mentioned, we're going to share some slides just to help us kind of level set and be on the same page about definitions and things so that we can have a great discussion at the end. So if you bear with us, we'll share some slides for about the first 20 minutes and then we'll open it up for discussion. But please feel free to put questions in the chat, in the Q&A, or however you want to share questions. Please also feel free to send questions to Dr. Salim or myself. If you don't want to ask them yourselves, we're happy to read them out and answer the questions in that way. So if you're comfortable, you can put it in the full chat. If you would prefer, you can send it to one of the two of us and we will read it out during the Q&A. Okay? So I'm going to prepare to share my screen. Okay. I want to confirm before we start, even though we've been on Zoom forever at this point, can you all see the screen with the puzzle pieces that says mitigating harm? All right. So a little bit about us. I know that we were just introduced, but Dr. Salim and I also always like to give just a little bit of background about why we do this work and where we're coming from, because we believe it's important. We borrow this from qualitative research and psychology, where you kind of give what your background is in the sense of like, what is the lens that you're coming from? So you can understand the information that we are sharing is coming from a very specific lens for us. And so we also encourage people to read. We'll share some resources yourselves so you can also have a different interpretation based on your social identities. So I am a licensed psychologist. I am also a Black woman. I was raised in the Northeast, and I currently reside in the South. So a lot of the work that I do when I'm talking about racial microaggressions is coming from the space of intersectionality as a Black woman. So thinking about what it is to have different marginalized identities and how does that play a role into microaggressions. And I'm normally thinking about it through a lens that allows me to apply it in intervention. So how do we think about how we're coping? How do we think about how we're helping to heal from it? And how are we thinking about how we're going to move forward? One of the things I like to note is that when I say coping, as we talk about it for this discussion today, at no point do I think it is a responsibility of any marginalized community to have to adjust to being oppressed. When I say coping, the goal is these are strategies to help to mitigate any discrimination or racism that you may be facing because we cannot control other people. So I like to put that out there that I do not think it is on us to have to just figure out how do I live with discrimination, but it is on us to help us to figure out how do I get through daily life while this is happening because I cannot control other people. Dr. Salim?
Yes. Hi, everyone. Excited to be here with you today. And as Dr. Jackson said, I think it's just really helpful as we begin conversation to ground ourselves in the identities that we hold. And for me, I am coming from a place of being a mixed race, Black woman, so born in the South and have lived in the Northeast as well as on the West Coast. And I am currently an assistant professor at Stanford University. I'm trained as a clinical community psychologist, and a part of that training, we are trained as researchers, we're trained as therapists. Although I'm not currently seeing patients, I think about my clinical training so much and how I approach my research and the implications of my work. I also think about it in terms of how I relate to others and how I hold conversations, right? So in terms of the area of focus for today, a lot of my work focuses on the impacts of race-related stressors on the mental health of Black youth and particularly adolescents. And I think a lot about how to help youth of color be able to manage the impact of race-related stressors. And particularly thinking about how families and schools socialize youth to manage that, and how do we equip families, schools, and youth with tools. And so I'm coming a bit more from a lens of thinking about the youth throughout their development, as well as early adults or folks in early adulthood. And a lot of that is really relevant even to our conversation today, because we know experiences in terms of how we identify, whether that's in thinking about our intersecting identities or whether that's in focusing really on our ethnic racial identity. We know that those early experiences that we have with race-based stressors or even in identity formation really influence the way we see ourselves as adults and shape the way that we sometimes even respond to race-related stressors. And so that's just a tad bit of background about us, and then we'll now go into a quick overview. So we're going to start, like Dr. Jackson said, with a quick, just kind of getting us on the same page definitions of racial stressors, including microaggressions. We're going to talk a little bit about kind of resisting and coping with racial stressors, and then we're going to go into more of a reflection, discussion, Q&A.
So we wanted to start off, this is one of my favorite images that happened. This picture was taken during protests after the murder of George Floyd. And I have used this when I have done grand rounds and other presentations in hospitals and academic medical centers, because I think it's really important for us to remember this is not new. While there is a refreshed wave of people wanting to talk about how do I address microaggressions, how do I cope, how do I even identify them, we have actually been dealing with this for centuries. And so I like to remind everybody here, especially for the Black physicists, to remember that you do have strategies within you. I think sometimes we can forget about them, but we have been dealing with this since you were born. And so a part of what today is we're going to highlight how do you tap into the skills and strengths you already have to deal with what has been going on.
And so we're going to start again with just understanding what are race-based stressors and how can they impact us. And so when we talk about race-based stressors, we're really thinking about the fact that this can include these interpersonal experiences that we have one-on-one, vicarious experiences, and even systemic experiences that we can have, right? And so this can, these experiences oftentimes overwhelm our capacity to be able to cope, and or can be related to negative outcomes. So we see within the research literature that experiences with racial discrimination, for example, are linked with negative mental health outcomes, physical health outcomes, academic outcomes, and even overall self-concept and self-esteem. There are many ways that we can think about race-based stressors, right? There are different forms of them, as we see on this image here. And just a couple of examples, because oftentimes people ask us, is it just the interpersonal experiences, right, that someone may have? And we say it can be those. It can also be something vicarious, right? So the ongoing viewing of killings, right, or harming or violence against Black and Brown people, folks who identify with your ethnic racial group. And then also kind of this ongoing hearing or seeing of racial epithets or racial teasing or bullying, right? So it can be interpersonal, it can be vicarious, and it can be something that can happen in a one distinct time, or it could be something that happens over a period of time. But these are all examples of race-based stressors, and these are just a few we highlighted, but there are more. Yeah, we can go to the next slide.
So microaggressions, kind of what we're focusing on today, are another type or a form of a racial stressor. We provided kind of the formal definition here, but the way I like to help people to understand what a microaggression is it's something we want to make sure that we don't invalidate it, because when people think micro, they think, oh, it's something small. The term microaggressions is just thinking about it's something that happens so frequently that it doesn't always feel like it's some one big event. You don't even always catch it in the moment. So it's not that you immediately think, oh, this was a microaggression all of the time. And it can be something as small as somebody sliding the money across the counter instead of touching your hand. It can be somebody making a comment about, you're so eloquent, you speak so well, right? And wondering why, well, I'm in grad school, why wouldn't I speak well, right? That can feel like a microaggression. And what we know from the research, and all of you probably from your lived experience, is that with microaggressions, the most stressful piece is not always what just happened, but it's that brief moment after it happened when we are trying to figure out, do we address it or not? That is actually the most stressful part of the encounter. So when someone says something like, you speak so well, the stressful encounter happens immediately in the sense of, do I say something about this, or are they not being offensive, right? Like deciding, is this offensive to me? Is it not offensive? Do I address it? Do I ignore it? Because all of this happens very quickly. We're not necessarily conscious that this process is happening, but when it happens, that is where we feel the most stress. And that is often also why afterward people may feel guilt. I should have said something to them in the moment, or I should have told someone, or I should have addressed this and cleared it up that what they said was offensive. Because it feels like we only have a moment to decide, how do I handle this situation? A prominent psychologist who really has pushed the movement on microaggressions, Dr. Sue, gave the example once of being on an airplane and somebody asking him on the airplane to move his seat. And so the decision is, did they ask me to move my seat because I identify as Asian? Are they asking me to move my seat because on this side of the plane it's heavier? Are they asking me to move my seat because I'm the closest person who can move, right? Those are all the questions that we have when a microaggression comes up. It's like, why is this happening to me? That is the stressful part, is because we don't know the answer and we're trying to make it make sense. So there are three types of microaggressions that are classically defined. They're micro assaults, micro insults, and micro invalidations. So micro assaults are what you most traditionally might hear. It's what we might say is the overt discrimination. So it's something, if somebody were to use a racial slur, if somebody were to put up a sign letting you know that you're not welcome somewhere, it's what we're most known, what we understand most about the typical racism. Micro insults are things that disregard or communicate insensitivity for somebody's identity or heritage. A micro insult, for example, might be somebody saying, I don't see color, except that I'm Black. So when you say that you don't see color, you're really saying that you don't see me, right? That is insulting. And a micro invalidation is a comment or action that ignores or dismisses a thought. So when people say, why do you always bring race into it? Or they make a comment like, you're so sensitive, right? They're invalidating what your experience is, what your lived experience is actually in that moment as a member of an underrepresented community.
And so what we know about the impact of microaggressions is that there is research that shows that they can have a negative impact on those who are experiencing them, right? So they can be stressful, they can cause conflicts, they can have an impact on self-esteem, mental health. And there's, this idea that Dr. Jackson was getting at before in terms of the lasting impact, right? And so oftentimes the stress response from the microaggression can last long after the assault, right? Because oftentimes the person who experienced the microaggression spends time almost like ruminating, right? So thinking over and over again about that situation. Or I think in the example that Dr. Jackson shared about, I think it was Dr. Maybe Sue, who was on the airplane, right? So trying to figure out what was that interaction about? Was that about my race or my ethnicity? Was that about something else? What did that mean? So that time that is spent ruminating and reflecting about whether or not that even what that comment meant in itself can cause a lasting impact on an individual. And oftentimes these things in a single incident may not be associated with something like causing a depressive episode, right? But it is something about the accumulation of these experiences over time that can have a negative impact or consequence. And we're going to, on the next slide, get into racial trauma, which we will talk about that cumulative experience as well. But the one example that we can think about in terms of a metaphor is even thinking about something like a mosquito bite, right? And thinking about maybe one mosquito bite, it kind of bothers you when you get bitten. But if you get several of those over time, it can impact you more. And I think oftentimes we can think about the fact that Dr. Jackson, I think I've heard you use the example of the Zika virus, right? So sometimes there are mosquito bites that will bite you and they'll be small and they may not cause a big impact or an infection. But when we think about something like the Zika virus, right? And the fact that you might not know which mosquito bite could actually end up biting you, and then that gives you an infection or causes some really long-term significant damage after the accumulation of several bites, right? Or after that particular one that was very damaging. That's how we can also begin to think about the impact of microaggressions and how it might impact people differently, and then also can cause this lasting effect over time.
So we wanted to highlight just a little bit about racial trauma because you can't talk about microaggressions and not talk about the subsequent trauma that can occur. And so kind of using the analogy that Dr. Salim was talking about, the thing is we never know which microaggression will trigger a larger response in us that is significantly going to harm our mental health. So for example, you might be in a lab where people make comments all the time about the only reason you are here is because you are Black, or the only reason you got here is because they needed diversity, right? I think as someone who's gone through grad school, we've all been in rooms and in spaces where people insinuate that it wasn't that you worked hard to get here, but that it's because of your social identities that you're here. And so that can feel like microaggressions, hearing them all the time, the accumulation. And sometimes something else happens that then our response feels like it was a traumatic event, right? We talk about racial trauma. And this can come from maybe somebody using a slur word in a large space and you feeling caught off guard. This can look like maybe if you've ever done a presentation, somebody disrupting your presentation to say something that is racist or feels like it's overt discrimination for you. And so we want to acknowledge that not everyone, but some people who experience racial discrimination also experience racial trauma, right? Just because you had a microaggression does not mean it will feel traumatic, but it can. And racial trauma is just recognizing that there is mental and emotional injury that was caused by an experience of racism. And so on the next slide, Dr. Salim will highlight how you can tell the difference between the two. But I just wanted to kind of share generally what racial trauma is and recognize that it can feel frightening. It can feel dangerous, and not always dangerous in a physical sense, but dangerous emotionally. When you hear people talk about safe safe spaces and psychological safety, this is what we're talking about. You may feel physically safe in a space, but you may not feel emotionally or even mentally safe in that same space, right? And racial trauma can be attributed to a single racially traumatic incident, or again, the accumulation. So it may be that in your lab, you experience all of these microaggressions, and then 2 years later, you recognize, like, actually, this is racial trauma. Like, the accumulation of dealing with that day in and day out has significantly impacted me. I now feel hypervigilant. I now have difficulty sleeping. My mood has changed. And that wasn't something that happened all of a sudden when you were in it, but you recognize that altogether, now this is having an impact on you.
Absolutely. And so these are some of the symptoms that you can see that can, the accumulation of symptoms, right, that we see related to racial trauma. And oftentimes there's different folks who might call race-based traumatic stress or racial trauma different things if you look within the psychological literature. But some folks talk about how it does elicit symptoms very similar to post-traumatic stress disorder, right? And so some of these things that we have on the slide, that hypervigilance, right? So always worrying about the next time you might experience a similar stressor or a similar traumatic event. It can impact your mood. It can cause anxiety, depression, right? It might look like avoiding situations. So not going back to or avoiding things that could where you could actually experience that trauma again. It can look like loss of concentration, right? Not being able to focus or having low energy and fatigue. So the cluster of these symptoms can be an indication that you might be experiencing something that is linked to race-based traumatic stress. And as we've been saying throughout, one unique thing about this is that oftentimes with something like post-traumatic stress disorder, it's one single incident that is often tied to all of those subsequent trauma symptoms. But here, it can be a single incident, right, that had an impact on you. It could also, again, be the accumulation of these incidents over time that cause these symptoms that then are impacting your functioning, your well-being, your health. And so it's really important to know when something is actually impacting you at that level, which is when we start to talk about it as racial trauma or something that's really influencing your overall well-being, your functioning, and or whether it's stressful, and recognizing that stress and the accumulation of those events over time can shift. And so those are some ways to start thinking about and reflecting on whether experiences can be stressful or whether they're lending themselves to potentially be traumatic.
Right. And just to add to that before we move on to the next slide, and then we'll be opening it up for discussion after the next two slides, is we also want to highlight that as much as we try, when you experience microaggressions and then you experience some of the symptoms that are on this list, you're not always going to be able to tie it back to the specific microaggression. So you're not going to be able to say, oh, when so-and-so said this to me, that's when I noticed that I started to have concentration issues or memory issues. It normally is that over time you notice, maybe 2-3 weeks later, I haven't been sleeping well. I feel really fatigued and I don't know why. I don't know why I'm having trouble remembering things. So that is the difficulty in it, is because we're not always able to tie it back to something specific that happened, because these symptoms do not just pop up immediately after it happens. It's a part of what Dr. Salim was saying before, the rumination. So again, going back to that stressful piece of how should I have handled it, we start to think about it. And then we find ourselves thinking about it over and over and over in a loop. I should have said something when they said it. I wonder why they said this to me. Why does this happen to me? And after time, we start to see these symptoms. So I just wanted to highlight that, because I think sometimes people will say, well, it couldn't have been a microaggression, it couldn't have been racial trauma because I didn't notice that I was feeling depressed right away. It's like, actually, it takes a little bit of time before you can see this, and you can't always attribute it to a specific incident.
And I'll also just quickly add to that as well that sometimes people talk about this idea of imposter syndrome. Or this feeling of inadequacy. And I think that's another example of how these stressors can really manifest and how they can impact you, especially in the workplace or within your career, right? So even having these thoughts that might feel self-defeating or might feel questioning, your identity, your ability to carry out tasks or to perform well. I think that that's another piece that as we get to the discussion, perhaps we can have conversation about if that's something that people would like to explore too, because that's something that I heard a lot with the folks that I worked with in therapy when we started talking about these experiences.
Right, absolutely. This is just a chart. So we also recognize that when we talk about microaggressions and racial trauma sometimes, this is more for our visual learners. It can feel like an abstract idea because it is such an unconscious experience that we're not aware of it happening in the moment. So this is a chart that Dr. Carter, who's in, I think he's at Columbia, that he put together to help people to understand how it works when we have an experience of racism. And the key here is that you experience the event as negative, memorable, sudden, or uncontrollable. This is important because when we talk about perception, so when people say perceived racism, it is not to invalidate that you have experienced, that what you experience is only your interpretation of it, but to remind people that what may feel racist to me may not feel racist to someone else because of your experiences. So if, let's say the example that I gave before, if I'm in a gas station and the attendant does not want to touch me and they push my money across the counter, I may experience that as racist because I was raised in the South or I live in the South and I understand that there's a hidden meaning behind that. So then I experience it as negative. I experience it maybe as uncontrollable. I cannot stop this person. Even I may experience it as sudden. Dr. Salim, for example, may experience the same thing. Somebody slides the money across the counter. And if she doesn't have that same context of understanding the hidden meaning, she is not going to find it racist. And so it's not going to have the same impact on her, even though it's the exact same experience. I think this is important, especially as we are, when you think about your experiences in academia, because sometimes when we're looking for support from other people who may look like us or we feel like we have the same experience, they may not be having the same experience. It doesn't mean that what happened to you is not a microaggression or that it wasn't discrimination or it wasn't racism. It just means that they have different resources. I call it the backpack because Dr. Carter talks about unpacking up here and I always call it the backpack. Their resources might be different. So the lens they're interpreting it through, their perception, then they didn't experience it maybe as negative. And so I think this is important because sometimes when we're discussing different situations, you'll have someone who will say that wasn't racist. And it's like, yes, maybe it wasn't for you because you have a different lived experience than I do.
And so as we're transitioning to think about getting on the same page of kind of what these experiences are, how we can define them and better understand them and see them when they're happening, I think another piece is, so what do we do? What are things that can help? And so these are just a few quick bullets that we put here to start the conversation and to have us start reflecting, right? And so we know that one example is quality social relationships, having a strong sense of community and having social support and having safe spaces to talk about these experiences, for example, is known to reduce the impacts of race-related stress on outcomes. Also, research shows that having some sort of spiritual engagement or religious practice that can help reduce distress is something else that can be very helpful and can, again, be a buffer for how to manage and how to respond to these things. Again, talking about these challenges, again, in these safe spaces, I think it's safe space might look like a therapy session. Safe space might look like a collective group of folks with shared experiences who can understand and where you can process, and sometimes even where you can make sense, right? Because make sense of some of these experiences, because as we talked about with microaggressions, sometimes they're subtle. They're oftentimes not the very, they're often not very blatant. There are experiences of race-related stressors, right, that are blatant, that are very obvious, but sometimes these things are very subtle, and making sense of race-related experiences and understanding, having that community to process them in can be very helpful. I think we also have to spend time thinking about joy, right, and resistance and healing, right? So a part of that might be celebrating victories, right? It might like practicing self-care, figuring out how to set boundaries, figuring out how to respond to these situations, right? So how do we name it in the moment? How can we kind of name and call out people that might have perpetrated the experience and say, and that can be a one-on-one thing, right? That can be, I experienced this. This is what it sounded like. This is how it made me feel. It might be you see someone else who's engaged in one of these things, maybe engaged in a microaggression, and you name that, right? And that can even be from a position of an ally or someone where you're standing in solidarity. If you see a situation happening to someone else, there is room to figure out how can I kind of step in or speak out or call it out in the moment, maybe in that situation, to name that as such. And also just thinking about how do we foster radical healing and radical hope, right? There's many ways to do that, but recognizing that people that came before you experienced these things, and that doesn't make them right. That doesn't mean they should continue, but it does mean that there are ways to resist and respond. And there are strengths and tools that you have that have made you resilient. And so I think that's an important piece too, is how do we build on our ancestral strengths? How do we build on the skills and tools that we do have, and still be able to practice that self-care and that joy despite these things happening, but also acknowledging the reality of them, because we know that if we ignore them and we don't acknowledge them, that isn't going to contribute to the healing process. There's a combination of acknowledging it, figuring out how to respond, and practicing that self-care and practicing that self-compassion with these things. And as we talked about, or as I mentioned earlier, that can be in a safe space with people that you trust, and that can also be in an individual space with a therapist.
And I just want to highlight, I have this image up here. I don't know any of you if you've ever seen Grownish, but this was from an episode of Grownish, because I think one of the things as a licensed psychologist, when I think about therapy, I'm wanting to indicate that a key is also finding people use culturally relevant, culturally sensitive, but a therapist that connects with you. And so we can also chat about that in the discussion if people have questions about how do I find that therapist. But a part of it is you want to find a therapist that you connect with, and remembering that you are the consumer, you have choice. So I think sometimes when people go and they decide, actually I have been harmed by these experiences, it may be racial trauma, and they want to go and see a therapist, then the question comes up, well, how do I know who works or fits for me? And so this is just a reminder when she's saying like she stopped going, also that you can have another opportunity to find someone. So normally when people come and see me in my private practice, I tell them, right, we have to see if this is a good fit for both of us. And so it is completely okay if you connect with a therapist, you're like, this person doesn't work for me. They're not offended, right? They understand. And then how can you find someone else that will connect with you? And it may be across social identities. And I just wanted to highlight that. So our last slide before we start the discussion is I just want to give you a coping tip. So we've talked about what are microaggressions, what is racial trauma, what are racial stressors. And so a fundamental coping tip is the feelings wheel. So I used to help lead a race-based traumatic stress group at the VA. We developed a curriculum for it. And the thing that we found the most, and I have found this often also in academia, is that we intellectualize the experiences of racism and discrimination that we have. And what that means is that many of you, probably when something happens to you, when you have an experience, you describe it to someone, but you don't tell them how you feel about it. And so what happens is we don't get the opportunity to properly cope. So kind of like a coping 101 is using a feelings wheel. You don't know what you can do to help you to get through if you don't know how you're feeling. And you can find a feelings wheel anywhere on the internet. There's lots of images, worksheets you can print out. But it helps us to think about what are the feelings beyond our basic feelings. Oops, sorry. So these in the middle are what I might call my primary feelings. And so those are the words that we're most often used to using. Angry, sad, happy, right? The feelings outside of that are words that we're not used to using. And here's why this is important. For example, I might use the word mad all of the time. But what does that mean? Am I annoyed or am I in a rage? Because the way that I might cope if I'm feeling annoyed is not the same that I might cope if I'm in a rage. But if I lump it all in mad, I don't know what to cope with, right? And then I might say, well, I went for a run and that didn't help me. Yes, because a run helps when you're feeling annoyed. If you are in a rage, going on a run is not going to help. That's why it didn't work, because you weren't coping for the right emotion. So most often, we don't actually tap into how we're feeling. And so using a feelings wheel helps us to start to have language. Often I found with clients that I see, we don't have a language for our feelings. And sometimes it isn't even mad. I'm hurt, I'm embarrassed, I have resentment. That is very different. If I just keep coping with mad, then I realize I'm not feeling better. So I encourage all of you to use a feelings wheel when you have experiences and just practice just naming, pointing at all the emotions, saying them to yourself about how you feel. So then you can figure out, how do I actually accurately cope with what's happening for me? Maybe I'm embarrassed by what happened and not mad. So then what do I do when I'm embarrassed? And that's going to look different than when I'm mad. So that's just a kind of coping 101. And I'm going to stop sharing my screen now. so that we can jump into the discussion to see if anyone has any questions for Dr. Salim and I. And I think at this point also we're going to stop recording, I believe, so that people can feel free.
Recording stopped.